That's the idea.
Coronavirus with higher titers and twice the transmissibility. And as such, at current count, essentially all of the cases in Berkshire County are now Delta. That has led to an increase in hospitalizations, a few deaths. And as such, we feel that it's, the board believes that it's important to have the town practice as best as possible those protocols that are known to limit transmission, those being social distancing and masking, particularly indoors. I added to those whereases also that because children under the age of 12, i.e. most elementary school students, are ineligible for vaccination. So we have a large unprotected cohort among us. And also, as is known, household transmission is high with Delta, the Delta variant, and can affect even vaccinated household members just because of proximity and time. So we do have the authority to issue this under Massachusetts General Law 111, Section 31, where we may make reasonable rules and regulations. And so it started off now, therefore, commencing on September 10th, 2021 at 12:01 a.m., the following directives are hereby implemented in the town of Adams and shall remain in effect until this directive is rescinded and or amended. Item 1. And so Joyce and I will discuss this once I read it. Appropriate seat and code enforcement officer Blaisdell. Appropriate CDC approved masks or face coverings shall be worn in all indoor spaces in the town of Adams unless seated at a table consuming food and or drink. A sign shall be posted at the entrance of all buildings. An accessible sign can be found at our website, which I list here, and any other masking requirements. Establishments may use any other masking requirement sign with similar content. So where we have masks required. And sign. At this point, I will note that I received an email from Mr. Sharon of Original Seed, who has an adult only tobacco retail store. And as such, he has permission to have customers smoke cigars inside his establishment. So I'm, and obviously you can't, well, you can't smoke cigar through a mask, but I would suggest that possibly the indoor smoking would be similar to indoor eating. Do you have any thoughts, Joyce? So that we could add to this eating, drinking, and smoking cigars in an adult-only retail store. So keep it specific to that. That makes sense, Mark? So that is point number one, masking. Number two, food establishment employees shall wear a mask or face covering when serving customers. And here's the specific both indoors and outdoors. I know a lot of us have been doing outdoor eating, but we would like to up protection by having customers and staff masked during service. Mask number three, mask shall also be required in crowded outdoor public events and where physical distancing of at least 6 feet or more cannot be maintained. This includes, but is not limited to, events held at fairgrounds, parks, outdoor performance and event venues, restaurants, and etc. And I would again here like to add recess and school recess and school athletic events to that list because the Department of Education, elementary and secondary education does not address outdoor activities with their masking. They're limited to masking indoors. Does that make sense to you?
Yes, and we might also want to include sports and football managers.
Okay, okay, so schools,
Reading the statute.
amateur and recess.
Yes.
Okay, I will add those three, and of course, the usual, when you're out on the field, masking is as not necessary, but in particular, spectators, stands, or whatever physical distancing is not possible.
Mr. Rhodes,
Yeah, okay, can I wait until,
can you just speak up? It's hard for them to hear out in the hallway.
oh my gosh, we have a.
We're
Okay.
trying to social distance and, can't hear you back here. Sorry.
Got it. All right. Number 4, masks shall, this is just a typical how masks fit, shall fit snugly but comfortably against the side of the face, be secured with ties, ear loops, including multiple layers of fabric, and allow for breathing without restriction, and may be removed for eating, drinking, and smoking cigars where allowed. Disposable surgical procedural masks, N95s, elastomeric masks, cloth masks are permitted. Masks with exhale valves are not permitted. This is just general CDC. This is defining the CDC approved. Number 5, event planners and or any organization shall consider postponement of any outdoor or indoor event gathering where social distancing of a minimum of 6 feet per person cannot be maintained. And obviously, got to be some flexibility there. If it's a wedding or something like that, we are asking people to use their judgment. That's number 5, and number 6 is one that I added from the one that was template provided by Tri-Town Health Department. All schools in Adams, including private schools, are ordered to follow the universal mask mandate issued by the Department of Elementary and Secondary Education, August 25th, 2021. Parents, implementation of DESE mask requirement. Briefly, all students 5 and above, staff and visitors are required to wear CDC approved masks indoors unless eating, drinking, or taking a mask break. No cigars. exemptions may be granted for medical or behavioral reasons. Further details may be found in the DESI memorandum. So at this point, I will, and do either of you have a comment about number 6 there, please? Schools, okay. So I think it's now time I may open the floor to questions. Yes, sir. Say your name.
My name is David Moore. I'm a lifelong resident of Adams, and I have a few questions about what you just read here. I'd like to start at the beginning where you said that you, by statute, you can enforce this because this is not unreasonable. And I would say not only is this unreasonable, it's unscientific. Matter of fact, this offers no protection, but yet it's approved. Matter of fact, if done wrong, it can actually make people sick. Now, the exemption for health and mental health reasons, is that going to go to my customers? If someone has COPD, they have to wear a mask? If you're telling me that we have vaccines, but so if you're vaccinated, you have faith in vaccines, and so that's a question of statute. The next question is of jurisdiction. Did you take an oath to uphold the Constitution, sir? Yeah, as an oath of office, I know I've taken it a couple times. Did you take an oath to uphold the Constitution, sir? All right, so I'm just saying that this is totally unconstitutional and it's unenforceable. And if that's in the record, I'm happy with that and I'll leave because this is a joke. Thank you.
And thank you for your.
Does this kill virus? Is a virus alive? Is a virus even alive or is it protein? Does it want to kill its host?
We can talk.
All right, well, McDonald's, wait, we have a more important problem. We have obesity and hypertension. McDonald's sells fatty, sugary, salty crap.
Sir,
Why don't we ban McDonald's?
sir, maybe.
I'd like to make a motion that we follow Stanford's lead and we be a constitutional community. And the Constitution is the supreme law of the land.
Is there?
You want to wear a mask? Is there a second? I'd like to be a constitutional community and say, if you want to get a vaccine, you want to wear a mask, do it. No one's prohibiting anyone that wants to wear a mask from wearing a mask. Okay? And most of the customers I see are using them wrong and they're going to get themselves sick. I'd like that entered into the record. Do I have a second to be a constitutional? Can I have a second?
Sir,
I'm out of order. I'd like a motion that we ban McDonald's because it's killing people.
you are out of order.
Okay, I'll leave. Thank you very much.
Does this kill virus? Bacteria kills virus.
Mr.
Michelle, I've been here himself. God bless America. God bless you. God bless Adams.
Good afternoon, everyone. John Cowie. I'm still a town meeting member.
I didn't get your last name, I'm sorry.
COW, the thing that gives the milk and NIE. But I got your agenda here, and I guess I'm a little bit troubled because it's like what you're reading here. I don't want to get into the specifics of it because I want to attack it from whether or not we should be even doing this, because it reads, we're going to consider issuing. It sounds like you've already done the considering and you're going to issue it because you've already put in a date.
Is it a proposal?
It's a proposal, all right. So, all right, well, here's where I'm coming from with these, the masks and everything. As to your part that relates to St. Stan's School. Now, I have 2 grandchildren that go there. I'm not Catholic, my wife is. My son, he sends them there. Now, I know years ago, the town of Adams used to pay for a nurse at the school. They stopped doing that because they said it was unconstitutional. Okay, they can't be doing anything, no aid or anything going to the school. So my first point here is, under what authority, okay, would the Board of Health be addressing what the St. Stan's School does inside the school? Because the order that you're referring to, that August 25th order from DESI, does not refer to private schools, does not refer to religious schools. And I really think you're maybe opening up a Pandora's box here, but do you have any authority for having, what authority can you cite Did you get a legal opinion from the Attorney General of Massachusetts, from town council, that you can do this?
I will just say, two things regarding that. One is that, the diocese had promulgated their guidelines before August 25th, and they had not changed them, at least when I looked a day or so ago. And so, speaking with the health and safety officer, Bob Kircher of the Springfield Diocese, he said, we follow DESE. In fact, we're more strict. However, they're more strict than the pre-August 25th. And so we are trying to bring in alignment the current DESE. And the second thing I will say is that, the diocese has their guidelines, they put them out, the principals are more or less obligated to follow the diocese, but they're also obligated to follow local rules and regulations. East Longmeadow, for instance, in the community where their Board of Health issued a universal mask mandate to the diocesan school there, and the school immediately adopted it. And so there is precedent for local control, even with the Roman Catholic Church on the other side. I do not want to pick a fight.
I know, I understand.
And so
Neither
the
do I.
bottom line is that we have unvaccinated children, and we want to keep them as safe as possible.
What other what other communities acquiesce in what you're doing? What I'm asking is, it's just it's purely a legal question. Do you have an opinion from either local town council or from the Attorney General's office that you have the authority to issue that order and make it effective against St. Stan's School?
We have not checked, but let's just see if it stands. If you want to challenge it, please feel free.
And the second point is that since we're talking about masks, I'll wait. Oh, yeah. Okay, since we're talking about masks, what evidence do you have or did you consider concerning studies on masks, their effectiveness, the N95s, these things, that they had any effect to protect children in a school, other than if you open up the windows, you might have more effect. And I'm going to refer you to two studies, one that was done by the Chinese, Wuhan, China. This is where the COVID is supposed to have started. Now, they did a study, and the first part of it was they were talking, they did a study on testing everybody. It was like 10 million people. All right. Then what they did was they wanted to see who was positive. And then from them, of those who were symptomatic, okay, they ended up with 303 positive and symptomatic. And then they did what they do called contact tracing. So they traced out those 300 individuals, and they ended up with about 1,200 contacts. They didn't find one single contact that had gotten the virus from a positive, if you call it a case, all right? Then the British, they did a study that went directly to the mask. They used a mannequin, all right? It was done July, they released the results July 21st. Okay, so and what they found was, if you're familiar with it, then you know that they found that even the N95 masks were less than 3% effective in stopping the virus. So I guess my point here is, if you are really concerned about the Delta variant, and I think it's already peaked, but you can argue about that. And the move may be the new one coming that may be more deadly. But if you've already, let me go back here. if you're really concerned about the kids, why don't you close the schools? Because I think what we're doing here is we're gonna tell people, mask your kids, put them in a closed room, okay? The masks are gonna generate germs and everything. And you're gonna cause more problems with the kids.
If I may say, I think the studies we're following that masks are effective. Not only in, it's particularly effective at contracting the virus from someone who's infected. Both people wearing masks, it puts it down to a very low percentage. But having said that, I totally agree with you about the sanitary issues of masks. And we know kids, and it's like, what we would really like to see is that kids be able to exchange masks, clean masks every hour or two or whatever, rather than wearing the same mask all week long. That I do agree that constant wearing a mask for all day is probably not sanitary. And so that's kind of an underlying, and again, it's to some degree, it's common sense, but we will communicate with the schools. The principals have all been very accommodating to try to develop a procedures for making sure the kids have a constant supply of fresh masks.
The only thing I'm gonna add is, if you go back to when this all started, Dr. Fauci, the New England School of Medicine, they all said masks really aren't gonna do anything. All you're doing is you're helping alleviate people's fears over this, that they weren't going. And then within days of both of those, politics entered into it and they changed their opinions. And these things they don't work. You can cite anything, well, they just don't.
The other thing I would say is that I don't think we have any flu cases.
That's because the COVID wiped it out. The COVID pushed it aside, it's gone.
All the precautions we were taking, we did not. The problem with COVID is it's passed pre-symptomatically. The flu is not. You usually have the flu, you know you have the flu when it becomes infectious. And so the point being that we were all being careful with each other, washing our hands and so on. Flu cases went way down. And that attests to the effectiveness of slowing transmission. But I know that's apples and oranges, but I think at this point we need to move on.
But if we're talking about passing it on, that study in Wuhan, China, 10 million people. And these were people who were, they tested positive. They did not infect anyone else.
Regardless, we are moving on here. So thank you. Any other comments? And Jim, yes, how are you doing?
Okay, I'd just like to ask one question of everyone here. Who's gonna be the last person standing to say, gee, if everyone else died, maybe we should have had masks on?
Thank you for this uplifting thought. But yes, I agree with the sentiment.
You all drive to the right on the roads here, we trust everyone else will do that.
Yes.
Why? Because it's for the general welfare and good of the population.
So yes, thank you. Okay, so we're going to move
I do
on.
have a question.
Oh, yes, sir.
Michael Mucci, Adams resident. It was difficult to hear everything you said back here, and I look forward to reading it. It sounds like it may get voted upon before we actually see everything that you read. It sounds very grand and encompassing. I heard schools, outside of schools. I heard businesses. I heard public spaces. I heard sports. I heard venues. I heard just about everything.
Right.
And trying to understand if this is a model that's been approved by other towns or areas that you kind of making as the genesis for this, or, how did you decide to kind of trump what DESE's doing and other things have already established to write something that encompasses all those different elements?
Because community spread is high. High nationwide, it's high statewide, it's high in Berkshire County. And so it's not just the school kids that are at risk. And I do appreciate, and I very much appreciate, if we all just stayed home, the virus would go away, but we cannot do that. And we're trying to do the next best thing to keeping us and our children safe.
I certainly understand your sentiment and I appreciate it. Just again, is there another town or place that has established these rules that has made this board comfortable enough to reach out and encompass all these different things that you're putting into that letter?
But so far, East Hampton has very similar to what we've done. Tri-Town Health Department, Lee, Lennox, Stockbridge.
Have you approved that?
Yes, and so that's that was in the Eagle yesterday was the write-up. And yes, there's definitely pushback because it affects weddings and so on. And that's the last thing we want to do is that people have postponed weddings 3 times already. And we don't want them to postpone the 4th time, but let's just work a way. Let's just work and find a way to make those events as safe as possible.
Sure, I'm all for getting weddings as safe as possible. Did you also say that that was gonna be effective midnight tonight?
Yes. And I do, this is not a mandate. This is not a regulation. It is a call to action. So we are asking people to use their sense of community and willingness to basically pick up those protocols that stopped the virus last winter, and including there's the mask, the social distancing, also the hand washing, just making sure.
I don't mean to keep asking questions, but you're saying it's a call to order.
A call to action.
Call to action, is that enforceable by the town?
No, it's not. And so what we're hoping is that, if all your neighbors are doing it, you sort of say, yeah, me too. And and so, yes, I understand. There are going to be people who say, I want to be free, I'm not going to do it. And, what are we going to do about that? But we live in a community and that means all of us together. And so we're basically appealing to community spirit here.
Thank you, I'm just trying to understand what we're all doing here.
So this is a recommendation, not mandatory.
Suggestion.
We recommend
Well, we are,
at this time.
last week or 2 weeks ago, we did strong advisory. What were the words? And so this is basically trying to be one step above that without saying it's the law.
So strongly recommend it, but not legally enforcing it.
So there is one section in here that non-compliance with this directive may impact further spread of COVID impact. Non-compliance with this directive, the Adams Board of Health under its authority may implement more strict rules and regulations of this directive, including daily fines for non-compliance, suspension and revocation of the Board of Health. Preceding that is an onus on the businesses to enforce this directive.
So where's the line? Where's the line that you guys will not
Right,
cross?
so this responsibility is on the businesses to ensure that its employees, it's or whether like the venues, the organizers of the events, to enforce this. And so our enforcement of this would be upon the businesses.
And if we fail to enforce it, we're fine.
That could be, if you have permits issued by the Board of Health, then those permits could come under review by the board, up to including suspension or revocation.
We're trying very hard not to make this chisel a law in Granite, because we believe that townspeople really want to get rid of the virus. Mr. Simon.
My name is Don Summer. I don't know why we even have this long discussion. What the board is trying to suggest is something to help people in hands, to protect the kids and protect. I don't see it as a big, I own a restaurant. For the last month, all of our staff has always been masked up. The customers have to wear a mask when they come in. When they sit down for dinner, they can take it off. One person in all that time is complaining. And John states the studies in Wuhan. I would give that any credence. Wuhan, the Chinese people wouldn't even let the Americans and the international scientists come in to try to determine if that's where the virus started. You can cite all kinds of studies, but most of the studies, most of the medical people and the scientists have said masks work. They don't hurt kids, they don't hurt people. Let's put them on.
And it's the more we do now, the sooner we're gonna be through that's.
This was said a year ago.
Yeah.
Okay, well, I'm saying the same thing. It's gonna flatten the curve, wear a mask, and it just snowballs. So that's why I asked where the line is.
I don't want to get into the issue about why Delta, then there's some countries where we have 2 or 3% vaccination rate. And so, if that's not discussion for here and now. What it is, and so was there any-
Hi, so there's another variant that just came out recently. I mean, this is not going away. You're not gonna stop that. I hear you saying that you're doing this so that you can stop. It's not gonna be stopped. It's mutating, it's out there. It's not, you're always gonna have it, so.
This is indeed true, and I
So
would,
what is your
I would
line? Where do
raise-
you end up saying, okay, forget it, let's take the mask off? It's not going
there are
away.
2 very good examples about mutating viruses. One is the HIV, and the other is the flu virus. They both mutate like crazy.
Exactly.
And for HIV, I'm not sure there's a vaccine yet, but there is some treatment for it.
Just like this.
And for influenza, there is a yearly,
Okay, so I guess my question
and
is,
so
there's
there-
another variant coming behind this, so when this comes, are we extending it for that variant? What about the next variant? At what point do you say, this isn't going away, this is gonna happen, if you want a mask and feel safe, wear a mask, if you don't want a mask, don't mask, because the way it's over 2 years into this, and it's not gonna end, so. And you're citing these studies, but what studies are you actually citing?
So I would, I won't get into the freedom issue, but I have a granddaughter who's not vaccinated. And if there are unmasked people around, I don't feel free with her.
Is she masked?
She is,
Okay, so then she's doing her due diligence, you're doing yours.
and if you're saying masks don't work, that's,
I don't believe masks work. I know
So-
I've been working for, I travel, I work, I go here, I go there. All I'm saying is, you're talking about this Delta variant, which is super high right now. What about the new variant that just came out? That's coming. I mean, at what point do we say, we're not getting rid of this thing?
I don't know if
It's-
the current vaccines are effective against the new variant, but.
And now they're saying a booster every 5 or 6 months.
Well, we get a yearly flu vaccine, so, and, I think, and I wanted to hear from the
And
gentleman.
we'll actually get to like numbers, like where do you say, the amount of cases, right?
Right.
Because realistically, we look at Berkshire County as a whole.
You've had 7,500 cases in the county in 2 years. Those are facts. That's from the CDC website. So that's a 2-year period, 7,500 out of 100,000 people. So when do we actually bring science and math into this? If you're going to say mask up, you can't go attend a basketball game indoors because of COVID. Well, 7,500 cases, 125,000 people. 2 years. You got to start doing some math here. That's my only input on it. That we make these rash judgments and there's nothing to back them up.
Peter. I think Peter 41 has the word.
So there are no
That's
numbers.
hand raised.
Is,
I think Peter Christine
wants to, are they,
got his hand up.
okay, so can we listen to? Here we go. Oh, it's Christine. Hello.
Hey there. So just to follow up on the gentleman who was just speaking, he was asking about the number of cases, and maybe you talked about this at the beginning of the meeting, but what is the exact number of current cases in the town of Adams as of today?
That I do not know. I don't know if you.
It would be good to have.
Right, we will not know that because we don't have that requirement to be notified of information out of me. So we'll get that data about a week and a half from today of what we had.
So a week and a half ago, what were the numbers that prompted this mandate?
We're running in Berkshire County about 30 high 20s per day.
Specifically in Adams, how many?
That I don't know, but the point being that's in the county.
Can you rely on the data from Berkshire's? I'll give it to you.
Yeah.
They tested 800 cases and they had 46 that were positive. But to me, that doesn't mean it's a case. To me, a case is when you go to the doctor. Just because you're positive, you could still be asymptomatic.
But you can spread it. And
Well, but
this is
but that's where that study from
high
Wuhan comes in.
community spread.
10 million,
So I don't know about Adams per se, but
what evidence do you have?
I mean, yeah, you, Chairman Hoyt, do you work in Adams?
I do, actually. I work from home in Adams. And I sometimes commute to my office in Pittsfield. Now, I do have another question about the number of cases. Do we know how they're spread?
There is significant spread within households and also within workplaces. I think what started this was a particular establishment here in Adams where I think 5 or 6 people became sick all of a sudden. 1 died. Just the proximity, and it is known that vaccinated people are now less protected. I kind of think of it, the vaccines are not 100% effective, 95, 96, 97, but it's like hockey. Enough shots on goal, you're gonna get it. And so if you have someone infected in your household, whether you're vaccinated or not, there's a good chance you will also become infected. And as Mr. Cowley's point about being asymptomatic, not being a case, you still can transmit that. You can transmit that to your Aunt Ethel, who's been vaccinated, but the vaccine is not that effective because she's old and immunocompromised, and so she gets sick and dies. It is not an issue of, oh, kids don't get that sick, they can pass it on. They pass it on to their household members. So this is why we need to come together as a community and try our best to stem the spread, stop the spread.
So, and just furthermore, I'm just looking for some clarification because it's gone back and forth whether this is a mandate or it is an action that we are asking the community to wear a mask, to be more community minded. I do see that Attorney St. John is on the call, and I'm hoping that maybe he could enlighten us as to whether or not this is a mandate that is coming forward from the Board of Health, because I am assuming that he has read this ahead of today's meeting and might be able to speak to the legal issues that have been brought up. So I apologize to Attorney St. John for calling him out, but I do see that he's on the call and would like to hear from him about the legality of it and whether or not this is a mandate or if it is just an action that the Board of Health is asking people to be more community minded.
Thank you. On the Zoom screen, I see, I just don't see the gallery, so I don't know. So thank you for pointing that out. I didn't want to hear from Attorney St. John. Now might be as good a time as any, please. Are you there?
I am, and first of all, I haven't had opportunity to review this item that you're discussing today. It hasn't been presented to me yet. I haven't conducted any research on it whatsoever. It sounds to me that based upon your discussion, it sounds to me that this is a nice suggestion, but it doesn't seem to me that this is a regulation that's enforceable by taking any type of court action to enforce it. That's my initial impression at this point.
Yeah, you are correct, except for I think we would like to argue with the word suggestion. we are very, very, very strongly asking everybody to mask up, and it's based on our role in protecting the public health. Not just, oh, gee, it'd be nice to wave to your neighbor as he or she walks by. It's like, let's mask up and do our best. But thank you. You are right. It is not a
I have a
mandate.
question for Attorney St. John. So if the businesses do not follow the enforcing of the mask for their customers or their employees, is this fining of businesses going to hold up?
No, but there are no fines listed in here. And so we are asking, and if we find good compliance, we'll just say, hey, pat everybody in the back, thanks, let's keep going. We will revisit this, and I haven't gotten to that point. I mean, it's not like this is gonna last for a year. Hopefully not, but we'll be meeting next week as a Board of Health. We will reassess this, and then I'm gonna try to have board meetings every few weeks so we can reassess where we are, because the last thing I want to do is to have everybody masking all through the winter, but we'll be following DESE, DPH, CDC, and just trying our best to implement. So, did you have anything else, Christine, or Attorney St.
Yep, no, I did have another question. Your agenda stated specifically about an order for St. Stan's, and I'm wondering if there is a representative from St. Stan's in the room who could speak to it. This is a similar question to what I asked the Board of Health at your August board meeting. When you were talking about guidance for the educational institutions, I asked if the educational institutions had been invited to be part of the conversation. And I'm just wondering if somebody is from St. Stan's who's been invited by the Board of Health to be part of the conversation for today, as they were specifically called out on your agenda.
I've been in constant contact with Superintendent Joe Raji, and he's is anyone here from St. Stan's? Anyone from St. Stan's? He was very great.
It's got to be Joe, really.
I'm a parent of a student from St. Stan's. We had received a letter on August 30th regarding the mask recommendation, and it was highly recommended that students wear their masks. We had the opportunity to opt out of that if we wish. My son is in 7th grade, so he has been vaccinated, but chooses to wear his mask every day. I will say probably 97% of the students there that I'm aware of wear their masks every day. So to impose that on a school that has taken a priority of their children's health all year long, they were in school all year long last year with minimal cases. So to point them out is kind of unfair to them.
I actually, what I wrote, and I should have amended the agenda, it's okay. Yeah, I don't think I'm telling anything that is confidential, but Superintendent Raji said he would be happy to institute the universal, but he's following diocesan guidelines, and which is what his obligation is as a parochial school superintendent. I think he feels supportive of a greater mask usage, and I think he would be happy. And I know there are a number of employers who would love to have the backing, the support of the board in order to take the onus off them. Why are you asking me to mask? Here we are, the Board of Health. We're I don't want to call us the bad guys, but we want to be the ones to say, let's do it, so that you can say the Board of Health says do it, not. Does that make sense? We want to use our what authority we have and expertise to issue the strongest directive, just short of a mandate. So, yes.
My name is Wayne Piaggi, Temple Street. No disrespect to this board. If you are doing this to get the people behind you to get to do the right thing, we're all older. We're all over 40 in this room. Our entire lives are fact-driven, data-driven. You came to this meeting with nothing. You should have come to this meeting saying statistics for the last 10 years to show the people this many people died from the flu, this many people died of pneumonia. Do you know how many people died 10 years ago from pneumonia compared to who's dying now from the virus? Is it the same? Is it bigger? You don't know. Now you want us to get behind you. We can't. We can't get behind you. You haven't done your homework. You said 15 minutes ago, I can't remember exactly, you said something to the fact of, can you do this legally? Well, we're going to throw it out there and see what sticks.
No, I did not say that.
I think the police would be kind of frustrated if we all looked at, in this community said, we know it's illegal, but we're going to whip it out there and see if we can get away with it.
That's not what we're saying. What we're saying is that on this short notice, we're asking for the community to get behind us so that if we can weather this current surge, and I know Mr. Cowley says the surge is at peak, already peaked. We don't know.
No, because you don't have any facts. You don't have the numbers.
We don't know. We do know that the protocols worked, and then when they relaxed, then the virus resurged. And so we're just looking at the patterns. We're following what Department of Public Health says, what CDC says, and also my county colleagues who are, we are terribly alarmed at what's going on. And
yeah, so I just can't throw out the statistic that we used when we kicked around this idea of implementing the mask mandate. And at that time, it was only for the St. Stan school, not for the businesses, and that only evolved over the latter part of last week. So on September 3rd, there were 71 cases in Adams, 41 were, those 71 were in 41 households. Okay, So that was a significant jump from our last report. And then I printed up the statistics that we get weekly from the county. If you don't mind me passing it.
Go ahead, yeah.
If you might want it. So I only have 9 copies here, so if you really don't want it, let someone who really does want it have it. So again, we're in communication with the Department of Public Health on a weekly basis. We're in communication with BMC on a weekly basis. And among that, we're also in communication with Massachusetts Health Board Association, which does provide legal guidance, not legal advice. They're the ones who created this template, and there are communities throughout the Commonwealth that are using, who have implemented this directive, some escalated to a mandate. And as Chairman Rose mentioned, Western Mass, East Hampton was the first community to implement this, and then in Berkshire County, Tri-Town Health is the one who led that. So it's not arbitrarily being implemented or being recommended or considered by this board. And it's greater turnout than anyone ever anticipated, and we appreciate that. You know, it might be advantageous if the board were to consider tabling this after further discussion. I'm not shut anybody out, so that the full board can hear the comments.
On Wednesday, our next meeting is on Wednesday. We can rearrange. I would not be happy with, but as far as Chairman Hoyt's question, yes, so Mark did remind me, in August, there were 71 cases in Adams, 42 households. So there was some household transmission in August. And so the 71, you're talking 2.5 per day. So that's not chump change.
And at our next meeting, we will have the Berkshire County Board of Health Alliance, as well as our public health nurse present, who could maybe answer those. They're the science of it all, and they're the ones who we get our local Adams.
Our public health nurse, yeah,
Right.
our public health.
She has that. Of course, she can't divulge a lot of the regulations, which is why we didn't get that information directly or share it with the police, unfortunately.
That just follow up on your, so that was, we don't have time actually to announce this as a public. Well, actually, if it's not a regulation, we don't need to publicize it in the newspaper. But I think if we can get the word out, and I will put a version of this up on our website so that everybody can look at it ahead of time. It was a little bit, you might say rushed. I feel rushed, but largely because I feel an urgency. So please take that into consideration. I think we all feel some level of urgency here. Erica.
Erica Giorgetti, I'm the director at the senior center in town. I live in Adams, and I'm actually a St. Stan's parent as well. So I'll just start with the St. Stan's piece. I'm a new parent, and I echo what Amy had shared as well. That from the beginning, it was very widely communicated that, you know, wearing masks at St. Stan's was heavily recommended. The notice went out encouraging parents to sign or to say they weren't and why they weren't. And so it would be interesting to see, not interesting is the wrong word, but it would be nice to be able to see, you know, that continue for them. I do think that most children that I've witnessed myself have all been wearing masks. And I personally am happy for that, as I do have a young child. I'd like to see the students masked. But I do think they're doing a very good job at educating and communicating the need for their students to be recommended masked up. I would love to be able to see the board continue to do education as I think you have about wearing masks and about becoming vaccinated for those who haven't yet. I do think there's a handful of people who haven't been vaccinated who are coming down with the virus, and personally, I've heard from a handful of people myself who had said, I'm gonna get vaccinated when I should have got the vaccine. And so we are gonna be having the mobile health van come down to the visitor center. We're just working on mailing out that date, so hopefully we'll be able to have them come down to more public events, and that we have, many committees have worked very hard on planning through the fall. And then I'll just add, I would have loved to personally have seen this meeting a little bit later in the evening. I know there was an urgency to get it out, but I do think that if it was later in the evening, we may have had more people in the room who actually supported some of the things that you're trying to do. But I think having it later certainly would have been helpful. And then at the senior center in itself, there is a population of older adults who are vaccinated and who are comfortable not wearing their masks. And we do encourage them to wear their masks while traveling through the senior center. We're encouraging tourists who come to the senior center as well to put on their masks. And those who are not comfortable coming in an unmasked facility are just choosing to stay to themselves altogether. So I think that personally, we are managing it quite well. Without the order of the mandate. But that's just what I've been observing.
Okay, thank you.
Quick question here.
I have a question, about this paper that you sent out?
Yeah.
So right now, there's 8 confirmed hospitalizations. Is that for Berkshire County or for Adams?
That's for
Berkshire County, there's 8 people hospitalized.
no, that's up from like 1 or 0.
In all of Berkshire County, we have 8 people now.
Yeah.
Okay, I just want to be clear, it's not Adams.
But it used to be 1 or 0.
Okay, well,
Yeah.
I get it. So 8 people are in the hospital, and so how many people from Adams have been infected? We don't know that number, or did you say
In
that?
August, total was 71.
But that's not Adams, that's Berkshire County.
That's Adams. It's 71 in August.
And that is where?
What I'm telling you right now, this is what
Okay,
was
so it's not
relayed to
us.
us by our public health nurse.
So this sheet comes from Berkshire Medical Center. That's our
Okay.
Wednesday conference call. So this data comes from their records, and that includes both BNC Pittsfield and Fairview, South County.
So, okay, I just want to make sure, I'm trying to wrap my head around all this data. So 71 cases in Adams since August. So we don't know how many are hospitalized. We don't know that?
So I also want to call your attention to the chart at the lower right, where it's positive patients by age. And you will notice the skew toward younger, below 60. Substantial number. Now, the biggest bar, not by much, is the 20 to 29-year-olds.
Sure.
And they also have the highest rate of hospitalization. So
Okay, see, that's
we're
what I,
talking about young people.
yeah, want to see more than cases. I mean, everybody cites cases, there's so many cases. How many deaths are there? How many, ICU cases are there? Because the numbers are so different between cases and who's actually being hospitalized. So I hope at the next meeting, you'll have maybe more figures, more, guidance, what you're referencing as far as these masks work in outside settings, what are you referencing? What's the model you're using? And
So
you
I-
don't seem to have a lot of answers to that.
So again, when we had this discussion, it was not this type of forum. We had
That's
to leave it.
right.
Oh, no, last
When
week.
was this meeting called? When?
We posted,
2 days.
but we can talk outside the forum.
I'm just
okay?
curious
Or
when it
she
was-
and I could talk outside.
Yeah, when it was scheduled.
So,
when was it scheduled, she asked?
I'm sorry?
She asked a question, she needs to answer. When was it scheduled?
I saw it last night. For the
No.
first time.
We've been trying to put out the information.
So you scheduled the meeting last night?
Then we have week.
For today.
We're required to post a meeting on the calendar Tuesday morning, which gives us 48 hours, but.
So this was posted Tuesday morning to the public?
Yes,
Okay, and where was that posted?
on the town calendar. Although we didn't do the banner thing, but,
Okay. And then you put it out, I know you have a Facebook page.
yeah, that was on, yeah.
So that was on Tuesday morning?
But at Wednesday meeting, so next week,
Yeah.
15, the Public Health Alliance, no,
Yeah,
yes.
yeah, the alliance.
All right. So our public health nurse, we contract with Public Health Alliance. She will be here.
Yeah,
And
that's
she'll
great.
have more up-to-date figures.
Yeah.
She can't be specific again because of her restrictions. So when we had this discussion last week to hold a meeting to consider whether or not to implement the mask mandate. These were the figures. It was a previous issue of this, but the 7141 figure was the figure that we did use.
Okay.
All right, and again, you know, when we have the webinar with the state, they're giving state figures, and I give individual county figures. When we have our meeting with the county, they're giving countywide stats, okay? And there's no means, because we're outside the state of emergency. During the state of emergency, we had up-to-date figures that we were sharing with police, fire, and EMS.
So you don't
and
track that.
So we have those figures on a daily basis. Dr. Rhodes is actually the one who received the data directly from the public health nurse and then was conveying to our public safety personnel. So she'll be able to answer those questions regarding.
That's good, she'll have it break down by town rather than just by the county.
Well, I
Yeah.
would imagine, well, I'm saying yes.
It's in the paper. It's in the Eagle every
Okay, so
Friday.
our public health nurse,
Adams.
our public health nurse,
Last 2 weeks, it was
our
40.
public health nurse contracts with us. Okay, she works out of the county public health alliance. She may have that other data associated with communities she serves, not the entire county.
So, yeah, I can look it up in the Eagle. It'd be nice to know the numbers that we're basing this on. That's all I'm saying.
And
I
that's,
don't wanna know about
this is the
Berkshire
data.
County. You're asking Adams people to mask in Adams.
right,
so-
but this is the data that.
Yeah, I know. Yeah.
Where's your mask?
What's that?
Where's your mask?
Well, one employee.
Oh, so where's your mask? That makes a difference with your employees? There's a lot of employees.
Yeah.
COVID's not because of your employees.
Hold on. If you're gonna ask a question, please allow the answer.
Okay, I need to get that.
So you need to take off your mask here?
Yes, sir.
Okay, so one employee, so I'm not required to wear the mask.
That's bullshit.
That's what the board of selectmen have decided. And
So
two,
we don't have to worry about that.
and two, I have another.
It says it on the form, mask must be worn.
And two, John, I have a medical exemption, so.
What difference does that make? It's It's all in favor when you want it, or when we don't want it. It's different.
Okay, order, please.
Well, this
We
is
had a question
the answers we
over
want.
here on, was there a question?
Yeah.
Yes.
You do have a sign on the door that says mask be worn inside this building.
Visitors.
Doesn't matter if you're a visitor or.
Visitor? Wow, that's weird.
Still spread it.
You wanna come to my business and give me a fine, because I want to manage my employees, man?
So this is the problem.
That's crazy.
Asking us to do one thing, but it's not good for you guys.
Yeah.
And
Yeah, but
See, the trouble is.
that doesn't make any sense.
Order, and I think once, assuming we get past this, it will be revisited by.
Listen, we're all for good number of best what happened.
I'm talking.
Yeah, well, we're talking to you, you're gonna rub me,
So,
whatever.
this is a process. The board of selectmen will assuredly revisit their policies, which is what we want. We want them to be aligned with us as best we can. And Officer Blaisdell is correct. In his building, he does not need to wear a mask, and in fact, the regulation does state that if you're in an office setting and you're 6 feet apart, he's 6 feet from.
He's not
other
going 6
people.
feet away.
That's crazy, something crazy.
So please, let's not pick nits, let's just.
We're not, I don't know, we're not, it's not,
So,
I'm not just common habits building.
I think at this point, it would probably be worthwhile for us, member Gore, Officer Blaisdell, and I, just to finish. So I will ask the floor to be quiet.
I got a question.
No, I asked the floor to be quiet. I am, I actually am. You have no right to talk unless I recognize you. I do not recognize you, so please let us finish this. I will post it and then we will meet again on Wednesday. So.
In the middle of the day, bust my eyes.
Dr. Ross.
We encourage people, get vaccinated, get tested. Call.
Excuse me, can you
Berkshire
speak up? I
Health
can't hear you.
If you
Yeah.
have symptoms, anything else on
You
that?
have to speak like it's.
No,
Yeah.
oh, okay, so, there are a list of 4 things we are encouraging community members to do. One is to get vaccinated, stay home if showing symptoms. Number 2, get tested for COVID if you have new or unexplained symptoms, before and after traveling, or if you have been exposed. Number 3, if at risk to exposure, call and schedule a test. And it gives the Berkshire Health System COVID line. Is there anything else on number 3 that I went through the portal myself? But anyhow, that line should work. And then there is a listing here for information from mass.gov or CDC. So any other things we should encourage the community to do? I think that is fairly. And then we have exemption, 5 exemptions. The first is nothing in this order shall be construed to require a mask to be worn by children under the age of 2 or children who frequently compromise mask integrity with frequent manipulations or removals. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, or anyone who cannot wear a mask for other underlying health and safety reasons. Number 2, masks may be taken off at restaurant bars only while seated and eating and drinking. And so I will add this cigar in the adult only retail tobacco store. Number 3, employees in shared office spaces are not required to mask if social distancing of at least 6 feet or more can be maintained. Number 4, performers who are singing and or playing brass or wind instruments, who are performance artists or presenting or speaking at an event, are not required to wear a mask, to wear face coverings, but must adhere to social distancing of at least 10 feet from any member of the public when performing indoors and outdoors. And then finally, exemption 5 deals with swimming pools, and we're thinking about deleting that, but I will read it just before. Face coverings are not required and shall not be worn when actively participating in water-based activities and when swimming. Wearing a mask in these circumstances increases drowning risk. Face coverings shall always be worn when not in water, including but not limited to indoor pool decks, locker rooms, changing rooms, and restrooms. And agree with deleting that as unnecessary in Adams.
Yeah.
And then here's the enforcement, which we've talked about quite a bit already. I will read it as it is written here. The person or entity in control of a public indoor or outdoor space shall have the obligation to enforce the requirements of this public health directive set forth in these policies and procedures. Non-compliance with this directive may impact further spread of COVID-19, impact the health and safety of others. Non-compliance with this directive, the Adams Board of Health, under its authority, may implement more strict rules and regulations of this directive, including daily fines for non-compliance, suspensions, and revocation of Board of Health permits. So again, just emphasizing that we're asking for compliance, and if we see a problem, then we will react appropriately. This directive is in effect at midnight tonight, but we are posting, I'll change that. And this directive, the last sentence is this directive and its status will be reviewed routinely at Board of Health meetings. And because we referenced DESE, the current DESE masking implementation expires, but goes through October 1, at which point DESE will reissue, so we would like to be able to follow suit with DESE regarding schools. I think with that, I will ask, do I need a motion to continue this on Wednesday at our regularly scheduled? So may I have a motion to continue this discussion on, well, before I do that, I just, I had 2 agenda items on this agenda, and I would like a motion to combine those 2 agenda items into a single order as I have done here in this draft.
So,
second, I second that. This discussion is, it just seemed simpler rather than singling out one school, that we just incorporate into a single masking order for the town. Joyce, what do you say?
yes.
I say yes, so unanimous 2 versus 0. May I have a motion to adjourn?
So,
I second the motion, and before we adjourn, I do seriously, we've been battling here. It's true, but this is good. This is what we're here for, to hear everybody. Thank you for coming. I thank you for voicing your thoughts, opinions, understanding, your desires for the community, and so forth. So thank you. Do hope to see you again. My email address, I believe, is on the website, so you are free to send in comments if you're unable to come to the meeting. And again, thank you. How do you vote to adjourn? Yes. So this meeting is now of the special meeting of the Board of Health is adjourned now at 2:15 to 14 p.m. Thursday, September 9th. Consider. Yes.
Sorry, I'm breaking. I'm looking at the spot.
You know,